Study Session 7. History, Aims, Nature and Administrative Setup of the Medical Social Services Department, University College Hospital, UCH, Ibadan. Introduction. In this session, you will learn about the history of medical social service in University College Hospital, UCH, Ibadan. Also, the aims, the nature, and the administrative setup of the Medical Social Services Department will be mentioned. Social services have an origin, and all things that have to do with the origin should be understood. What then is the history, the aims, the nature, and the administrative setup of the Medical Social Services Department, UCH, Ibadan? Learning outcomes. When you have studied this session, you should be able to state the date the Medical Social Services Department, UCH, was established, identify the aim of MSSD, UCH, that relates to atmosphere, cite examples of patients that medical social workers counsel, mention the most senior staff of the MSSD, UCH, Ibadan, and history of the MSS, UCH, Ibadan. The University College Hospital, UCH, Ibadan, was established in 1957. It was established to complement the work of the Medical School of the University of Ibadan, which was established in 1948. The Medical Social Service Department was also established in 1957, the same year the University College Hospital was established. The first medical social worker at the time was Mrs. M. Omitowoju. The medical social workers by then were known as almoners, meaning the officers in charge of payments, that is, payments of hospital bills, drug fees, operation charges, etc. With professional training in social work, that is, Masters of Social Work, MSW, more qualified health, clinical, or medical social workers are now working in the department. Aims of the agency or department. The Medical Social Services Department was set up to achieve the following aims. 1. To make medical facilities available to patients. 2. To help the indigent patients in getting medical treatment. 3. To help the client psychologically regarding critical or terminal illness. 4. To create conducive atmosphere for the patients, both in the hospital and at home, that is, for inpatients and outpatients. And 5. To provide extramedical therapy for patients. The nature of services of the Medical Social Services Department. The Medical Social Services Department offers the following services in and outside the hospital. 1. Locating and contacting the relations or family of patients. Medical social workers in the department help in tracing relations or members of the family of the patients, especially victims of road accidents, unconscious patients, and other helpless ones. 2. Advocating for waiver, exemption, and sourcing for financial assistance. On behalf of poor and helpless patients, the department advocates that the hospital authority should waive certain amounts of money for those that cannot meet their payments, or that they should be exempted from payment. Also, the medical social workers in the department source for funds to help those that cannot afford paying their hospital bills, purchase their drugs, or pay for their surgical operations. 3. Counseling services. The department offers counseling services to patients with chronic, critical, or terminal illnesses such as cancer, HIV and AIDS, diabetes, chronic arthritis, and so on. Counseling is provided to individual patients and their families on how to reduce negative emotions or stress, follow medical regimen, and so on. 4. Rehabilitation services. The department provides rehabilitation services to patients. This is applicable to the patients who suffer disability. Example, chronic arthritis, fractures, limb or leg amputation, etc., and need to be rehabilitated. The department organizes occupational therapy for the patients before they are discharged from the hospital. This affords those with one form of disability or another to learn a particular trade or job with which they can earn a living or depend on themselves. 5. Reintegration services. The department helps to reintegrate the patients into the society. To this end, the social workers working in the department conduct visits to the home or environment of the patients before and after being discharged to prepare the family for accepting the patient back into their midst and for helping the patient to become well adjusted to the society. Departmental structure and organizational setup. According to Oyelaki 2004, the Department of Medical Social Services of the University College Hospital, UCH, Ibadan, is structured into 5 units, namely A. Surgical Outpatient Unit, SOP. This unit is also called Casual and Emergency Unit. It deals with emergency cases such as road traffic accidents, domestic accidents, suicide cases, burns, gunshot wounds, and so on. The unit provides welfare services to both in- and out patients. B. Pediatric or Children Outpatient Unit. The unit is popularly called Otumba Tuwashe Clinic. The unit deals with children-related cases such as anemia, febrile convulsion, nutritional problems, and so forth. C. Obstetrics and Gynecological Unit. The unit handles women's problems such as infertility, childbirth problems, and other problems common to women. D. Medical Outpatient Unit, MOP. The unit provides social services to in- and